Hello, my name is Brandon Kano, and this will be a video on showing y'all the bones of the skull. The bones in the skull consist of 22 total bones, and then the first bones that we're going to talk about are the cranial bones. In the cranial region, there are 8 cranial bones, 2 of them which are pairs and the others are singular. The temporal bone, which is one of the pairs, it's on the left and the right side of the temple. And the parietal bones, they are both separated by the sagittal suture, which is a little suture that is cutting in between the 2 bones. And then between those are the occipital, which is the back of your head, and the frontal, which is your forehead. And the last 2 bones of the cranial bones is the sphenoid and the ethmoid. From the last diagram, you could see the sphenoid bone, but looking at it from this anterior view, you can see that it's one bone connected, also called a greater wing. And the ethmoid bone, you really can't see it fully or clearly, but the ethmoid is just a small bone anterior of the sphenoid. And with this diagram, you can see each cranial bones separated in different, what you can call them, sutures. In the lateral view, you can see the coronal suture. This suture separates the frontal bone and also the parietal bones. And also in the lateral view, there are 2 squamosal sutures which separate the temporal bone and the parietal bones on both left and right sides. And then on the top view, you can see the sagittal suture, which you can tell by the name sagittal. It's cut down by the middle, which separates the left and right parietal bones. And the last suture is connected to the sagittal suture, which separates the occipital between the parietal bones. And lastly, there are frontanelles, which are spaces in between the bones that haven't fully formed yet. Moving on to the facial bones, there are 14 facial bones. Almost all of them are paired bones, but 2 of them are singular bones. First, you have your nasal bone, which is your nose bones, and there are 2 of those. Next, you have your palatine bones, which are just posterior palate bones. And the lacrimal are small bones that basically are your tear ducts. And the inferior nasal concha, which just states lower nose shell-shaped, which is just a shell-shaped nose bone within your nose. Vomer is just one bone within the nasal region. And your zygomatic bones, which are basically your cheekbones. And then you have the maxilla, which is separated in 2 bones, and it's just maximum part of the face. And the last bone is the mandible, which is your jaw, and then the only bone where you can move in the bones of the skull. And back to the cranium bones, and for the main functions of these bones is to protect the brain and its processes, which also includes cerebrum, and brain stems. It is a framework of the head. It provides attachment to the cranial and facial muscles, all connected to the bones. And the function for the facial bones, it houses and protects the sense organs of smell, sight, and taste. And then also, it provides a frame on which the soft tissues of the face can act to facilitate eating, facial expressions, breathing, and also speaking. And here's a sagittal view of the skull. It is more in depth, and you can see other areas of the skull. And within this, you can see the internal acoustic meatus, which is just the opening of your ear. You can see the hypoglossal canal. And then you can see the styloid process of the mandible, which is just a protruding part of the bone, and then it also facilitates movement within the jaw. And then you have the medial and lateral pterygoid plates, which help facilitate movement of the jaw going left to right. And then you have the mandibular foramen, which is just a small opening within the bones, and then this foramen houses and protects the inferior alveolar nerve. And then we have the lingula of the mandible, which is also known as the spix spine, and it is a triangular bony projection or ridge on the medial surface of the ramus of the mandible, and it provides attachment to the sphenomandibular ligament. And then we have the myohyaloid, and its main function is to elevate the hyoid bone and elevate the oral cavity and depress the mandible. And then the palatine bone, it helps form the nasal cavity and the oral cavity, as well as the pterygopalatine fossa. The vomer is to form the nasal septum together with the perpendicular plate of the ethmoid bone and the nasal septal cartilage. The inferior nasal concha works to filter, humidify, and warm the air that we breathe, preventing cold air from reaching the lungs. The sphenoid sinus helps make mucus to keep the nose from drying out. The sphenoid bone has many essential functions, as it helps form the base and lateral side of the skull in combination with the orbital floor. It also gives the skull its rigidity features and attachment for many muscles of mastication. The nasal bone is to form the external surface of the nose, nasal aperture, and to protect the nasal cavity from external factors. The perpendicular plate helps assist in forming the septum of the nose. Then you have the cribriform plate, which allows the passage of the olfactory nerves to the roof of the nasal cavity. The frontal sinuses also help to make mucus to keep the nose from drying out. And then you have the crista galli, which separates the olfactory bulbs. The hypophyseal fossa also houses the pituitary glands and the hypophysis cerebri. And within the external acoustic meatus, there are 3 small bones and 3 of the smallest bones within the body, which are called the malleus, incus, and the stapes. And the malleus is the largest ossicle in the ear, and its main function is to relay the vibrations of the incoming sound waves produced by the eardrums to the incus. And then we have the incus, which is also known as the anvil, and the incus transmits vibrations from the malleus to the stapes. And lastly of these 3 bones is the stapes, also called the stirrup. And the stapes has 2 branches known as the inferior and superior crust. This conveys the sound vibration to the bone's flat base. And that concludes my video of the bones of the skull and its main functions, and I hope you have a good rest of y'all's day.